Hi, today I'm starting a brand new series that I name it Hidden Cat Series. Is that to share those case or knowledge that I find that is interesting or is not commonly mentioned in the books or they just hidden in the large details. Then I like to raise it up. So the first one in the series is the management of asthma exacerbation. Yeah, this is a very common and easy case, but that is why I put this at the first one of my hidden case series. So we have a case here. A 28 years old male present to the clinic with worsening asthma. He's taking long-acting beta-agonist and corticosteroid inhaler for asthma. He mentioned his air conditioner is very moldy and worry about if this is the cause of his condition. And during the physical examination, we find there's bilateral risk on escalation on the chest, and his pit flow is 320 liters. And we also ordered a blood test with chest X-ray. It came off the result of we have high eosinophil count, and then the chest X-ray we find is bilateral patchy shadowing. So what is the next step management first? We don't have to think, right? It's of course we give prednisone to manage his asthma exacerbations, but what else? Anything more? I find that like many people they just stop at this step, but we have to think further. What more? What is there anything more? So, if you don't know, I can give you some hints of what key points we have to be aware of. First of all, he's taking his treatment, his asthma treatment, and apparently he is complying to this therapy. And then his air conditioner is very moldy, according to his words. So when you heard there's a moldy air conditioner, you may think of Naegelius syndrome, but in this case, it's not as severe, and those symptoms doesn't match, so we can exclude this differential diagnosis. But this is also one of a very important point, and a bilateral catchy-sharing. When you see this, you can think of fungi. So, and if I have to say which point is the most important one, I would say that is a high eosinophil count. So, in this point, I think everyone already know what is the extra. I mean, what is the management we have to also have to add up with the prednisone is we have to give the antifungal itraconazole. So we know that is fungi, right? But what exactly the diagnosis is? So it is an allergic bronchopulmonary aspergillosis. What what is the most specific characteristics leading to make this diagnosis is, as I mentioned before, a high eosinophil and also a high IgE. Like you can already confirm before you testify your diagnosis, which is by the in vivo allergic skin tests. And then yeah, so because like usually when we see there's asthma exacerbation, we just think of the next step management, and then we just give prednisone. But this case, why I like to share, because if we are not careful enough, we may miss the point of we have to add an antifungal agent that is itraconazole. So I find this detail is quite interesting, and so this is the first case of this series to share with you. And thank you. And if you find this series interesting or anything you want me to share, what topic, what feel free to leave it in the comment. And thank you so much for your listening. I'll see you next time.